Welcome. This brief information video is designed to give a bit of an overview regarding abdominal wall hernias. The abdominal wall has got certain weak areas, and there is a tendency on those weak spots to develop hernias. Any surgical incision can cause weakness of the abdominal wall and can lead to incisional hernias. Otherwise, there's certain weak areas in our abdominal wall include the inguinal, upper abdominal, epigastric regions, around the umbilical area, and just in the upper thigh, which is the femoral area. The most important thing when it comes to hernia is the risk of obstruction and strangulation. Hernia is essentially a weakness of the abdominal wall. Bowel can protrude and move from inside the abdominal cavity through that weak area or through that small defect and can lie under the skin. The narrow point of the hernia, what we call that the hernial defect itself, can cause blockage of the bowel by causing extrinsic compression, and sometimes it can lead to the strangulation of the bowel because the blood supply is knocked out. This is one of the commonest presentation in emergency and requires emergency operation. Not all obstruction require emergency operation, though. The image here basically shows in a patient two incisions in the groin. This patient had inguinal hernia. On the right, you can see a mesh which is placed in the groin in the inguinal canal. The spermatic cord, which is blood supply of the testis with three nerves going in it, is being lifted, and the mesh is secured to the back of the inguinal canal itself with sutures. This is another image where a surgeon is doing the same. Now, important thing here is to realize why mesh is now used in almost all hernia repairs. Mesh essentially leads to the scarring of the abdominal wall, and uh, the body lays down the scar tissue, which modifies and remodels over a period of time, and it's the scar tissue that strengthens the abdominal wall. The hernias develop there is a genetic element, of course, but certain acquired risk factors include obesity, smoking, previous incisions, and poor nutrition, as well as certain connective tissue disorder. In this patient's young female, you can see there are three incisions marked with black arrows, one around the umbilicus and two on each side of the umbilicus. These incisions are compatible with laparoscopic repair of the hernia. And down in the groin on the right side, you can see further two black arrows, which are compatible with open repair of inguinal hernia. So, young patients, even if they are not obese or not smokers, can still develop hernias. This is an image of a laparoscopic hernia repair. In laparoscopic repair, we make small incisions and dissect from inside the abdominal wall and place a mesh. You can see in these images how the mesh is being placed using laparoscopic instruments. Now, the hernia surgery can be fairly complex. This gentleman has got an incisional hernia, and after repair, you can see the results on the right side. The abdominal wall in cross section is shown in the image on the right, and where we place the mesh basically is an important part of hernia surgery, because mesh can be placed in front of the abdominal wall, behind the abdominal wall, or it can be sometimes placed as a bridge over the defect. In general, behind the abdominal wall is the best position to place the mesh. This image shows, in general, how we do a laparoscopic hernia repair. Basically, we make a small incision, put some air in the abdomen, which is carbon dioxide, and that gives abdomen give us working space. And then we put the further instruments, one for the camera and the others for dissection, and dissect from inside the defect from adherent structures if there are any, and then close the defect with sutures and put a mesh in. This image shows a small umbilical hernia, and a laparoscopic view, and we have put a mesh in one inside, and we have put it attached it with the abdominal wall using tackers. Tackers are just like staples. The mesh we use comes in contact with the bowel, and here we use composite mesh because one side is coated and it doesn't cause scarring. Or sorry, the bowel getting stuck to the mesh or adhesions. So with composite mesh, the risk is low. These images basically show the cross section of the abdominal wall and how the muscles are in our abdominal wall, and it is an important aspect to keep in mind when we are planning hernia surgery because mesh is placed at different levels. Strength of the rectus abdominis and corset muscle, the three muscles of the lateral abdominal wall, play a big part in terms of deciding surgery. We do routinely do abdominal wall reconstruction, which is complex hernia surgery, where we operate in between the layers of the abdominal wall. And sometimes, when the hernia is big, abdominal wall musculature is weak. We sometimes have to do staged operation where plastic surgeons can get involved. In addition, we may at times have to bridge the gap, the hernial defect itself. We sometimes have to inject Botox in the abdominal wall muscle to paralyze them so that we can easily close the defect. I routinely use ultrasound scan in my clinic. This is an ultrasound image of abdominal wall, and you can clearly see the three corset muscles: external oblique, internal oblique, and transversus abdominis marked, and the rectus abdominis in the midline. Different recommendation exist with regards to recovery and with regards to return to normal activities depending upon the patient, type of surgery done, the risk of recurrence, etc. I generally tell my patients for a straightforward hernia repair to return to normal activity with lifting and exercise in about 3 to 6 weeks. However, with the complex repairs, I'm a bit more cautious with my approach. The risk of hernia surgery includes pain, bleeding, infection, recurrence, and damage to the bowel, and in case of femoral hernia, blood vessels. Those risks are relatively less, but varies with patients and the type of hernia we are dealing with. For any further questions, please feel free to email me, and if you've please refer to the information leaflets provided because it will tell you exactly the incidence of complications. I hope this is useful. Thank you.